Tonight, we'll be covering Medicare scammers on To Catch a Predator. You hear about it all the time. People giving away their information over the phone to scammers, typically Medicare related or saying they're Medicare or they have a new option for them. So how do you know the person you're talking to is legit? How do you know you're not being scammed? Let's get into it and find out all about it. Hi, I'm Cullen Teska, a licensed advisor. That's important. Stick around to find out why, but a licensed advisor here at Strive Medicare, making Medicare simple. If you haven't, go ahead and like and subscribe and all the YouTube things. But today we're going to get into Medicare scams and how to protect yourself from them. And so I want to talk about some safe practices, give you some examples of what scams might look like, and then a reminder and a helpful way to know if the person you're talking to is legit or not. And so let's get into, first of all, what some scams can look like. So number one, your Medicare is about to get canceled. This is a common one. This is your last chance. They're always really pushy. They want to get in your face. They're telling you your Medicare is being canceled tomorrow or next week or something. And how do they help you? They just need to verify some information. So please give me your social security number, your address, your Medicare number. And if you give that to us quick today, you'll still have your Medicare tomorrow. That's not the case. They're just trying to steal your information. Medicare doesn't call you. First of all, here's a spoiler alert. Medicare doesn't call you. I'm going to say that throughout a whole bunch of these things, but they don't call you. You could get letters in the mail from Medicare. So, if you're talking about Medicare being canceled, that's very uncommon, but let's say something happened with your Medicare Part B premium payment method, and it's no longer being paid, you're going to get all kinds of notices from Medicare, Social Security, those sort of things, but they're not going to call you. So that's number one. Your Medicare is not being canceled, and if you get that call and you want to double check, just call Medicare. You can call them 24/7 and double check, but don't give your information over the phone in those cases. Number two, card replacement. This is another common one. They'll say that they need to send you an updated or new Medicare card or a new plan card. And in order to do so, guess what they need? Your information. And you give it to them and you get scammed. Don't do that. Here's another one. You get unexpected medical bills. This one's a little trickier and impressive in some ways. You get a bill in the mail for something that maybe sounds familiar to some healthcare you've received from maybe a familiar sounding corporation. But what these scammers do is they set up a fake healthcare organization and then bill you commonly received procedures. You submit payment for that, and now they take your money and disappear into the wind. So if you ever get unexpected bills or things that don't look right, number one, consider if you've had that ever done, or if anything looks fishy, don't pay it. Contact your doctor or a licensed advisor, which again, licensed advisor is important, and we'll get into that. But they're fake corporations and they may sound realistic. Here's another one, free genetic testing. Medicare's reaching out to you because Medicare now provides genetic testing to get cancer screenings or other screenings for diseases. Medicare doesn't reach out to you for free things. That's not that. There are things that Medicare will cover, especially within preventative care and some other things, but Medicare covers them through a licensed provider. Medicare doesn't reach out to you for that. So they call and say, Medicare is providing a free genetic screening for cancer. In order to save your spot, just give us your information, Medicare number, address, social security, and guess what? Then you're scammed. They take those things and they do all kinds of fraudulent things. They file claims, they open up accounts, whatever they do, but they can do all those things once you give them your information. Here's another one, mailers. The annual enrollment period in the fall, all the advertisements, you get all the postcards and all those things. And a lot of them are just legitimate advertisements. That is the time where business, health insurance businesses want your business. And a lot of them offer good plans, and so you can check them out. Here's kind of 2 tips on how to navigate mailers. Number 1, if you get a plan that looks good or looks better than your current plan, you can go to Medicare.gov, and on their Medicare Plan Finder, they'll list every type of plan that's available to you. If it doesn't show up in there, that's a big red flag. Or number 2, here we go again, licensed advisor. So if you're working with someone like us or someone who has established themselves as a licensed advisor, they'll be able to shop all the plans for you, tell you whether it's a plan or not, help you, know if it's something you should do. If you're not working with an advisor like us now, you could, you get the postcard, you're like, this is a good looking plan. Give us a call, give me a call. I will explain that plan to you, explain maybe what type of plan it is, and see if there's even better ones. Because when you get an advertisement from a health insurance company, they're trying to sell you their product, but there could be another company that has something similar or better. And by working with a licensed advisor, we can shop all of the plans instead of just the plans offered by one company. All right. Free medical supplies and other medical supply scams. This is probably one of the most common ones that we see here. So first, free medical supplies. Are you on Medicare? Here's all of the free things you can get. And this is really true with diabetes. If you're diabetic, really be aware of this because this is common. Here's all your free diabetic supplies that you need. And in order to get them to you, you just have to pay for shipping and handling. How are you going to pay for that? Oh, with a credit card. Here's my credit card information. Thank you. Goodbye. You never receive anything in the mail, and now there's a bunch of fraudulent charges on your card because you gave that to them. Medicare does not call you to provide you free things. Don't fall for that. or here, the other Medicare medical supply thing. I was just talking with someone, a real person here, who had received a back brace in the mail, and then Medicare was charged insane amounts, like $9,000. She got the claim back from Medicare, and then got another one for a knee brace and all these other things. First of all, she's like, I don't need these. And second, it's not fair that Medicare is being charged tens of thousands of dollars for medical equipment she didn't ask for. And so that one's a little different in that you are not necessarily losing money in that scam, but your Medicare account is being charged and the claims are being submitted under your Medicare number. And so don't, I'm starting to feel repetitive here. Medicare doesn't give you anything for free. Don't give your information out over the phone for free things. It just doesn't, there's nothing free in this world. So if someone calls you and tells you you can get a free back brace to help your back pain, don't do it. Either they're scamming Medicare, or you're not going to get anything in the mail, or you're going to get a bunch of fraudulent charges. All right, and then lastly, false refunds. So you'll get a call. Alert, you've overpaid on your recent Medicare claim or Medicare copay or what have you. And it's going to be kind of vague when you get this call. You're not really sure exactly what you're being charged, but you need this refund. You need to get this money back. So where would you like this refund deposited? What do you give them? Checking account information. Quiz. Do you get anything from this refund? No! They now have access to your bank account. You don't get a refund. You get taken. You get all your money gone. You get fraudulent charges. So don't give that. Don't fall for those types of refunds. Let's talk maybe about wrong claims. That can happen. We see that here. If you get a claim from a healthcare service that doesn't look right, contact a licensed advisor. We can take a look at your Medicare summary notice. We can see what an insurance company claims were approved or denied, and make sure that everything's correctly covered. Okay, even in that case, let's say that a claim was initially not approved by Medicare, and then we get it, because it was coded incorrectly, we get it resubmitted to Medicare, coded correctly in the claims process. Even if you're owed a refund, most of the time you're going to get a check in the mail. They're not going to deposit back into your account. So don't fall for that. Don't give your checking information over the phone for expecting to get money in return. Just doesn't happen. So now you're probably thinking, great, don't talk to anybody on the phone. Don't give my information over the phone. Just burn my phone in the fireplace. No, there are licensed advisors like us, whether locally or nationally, who work hard to provide you service for your Medicare products. And we're able to do that safely and in conjunction with you. So if you want to talk to us or a local agent that you work with or whoever, just make sure that they are licensed through getting their physical address, their producer number, their license number with the company that they're talking about. All of those things will help you make sure that they're legit. And number one, let's say you've contacted an agency or a health insurance company recently and want a review of your policy. You may get some inbound calls for that because you've requested that. But generally, if someone's calling you, they're going to be reviewing your existing policy because they're the agent of record or working with you on that. And if you respond to an advertisement, let's say on TV or a mailer or on the internet, and you call, make sure you know what plan you're on and what you're talking about. And so let's just summarize those quickly to help you avoid being scammed. First of all, if you are already on Medicare and you respond to an ad about a Medicare Advantage plan, most likely, typically, you can only enroll in an Advantage plan during the annual enrollment period, which happens in the fall, October 15th through December 7th. So if you're on Medicare and it is April and you see an ad for free benefits you can get through a Medicare Advantage plan and you call and enroll, that could be fraudulent because that is outside of the annual enrollment period. If you want to check out Advantage plans, just wait until the annual enrollment period in the fall and then contact a licensed advisor who will provide you outlines of coverage and brochures and guides from Medicare to make sure that you're looking at legitimate plans. And with Medicare supplements, in some ways those are even easier because in most states they come with a plan letter. So if you're on a Plan G now and you're thinking that it's getting too expensive or you want to explore your options, contact let's say it together, licensed advisor who can give you rates for a Plan G. And before you enroll, they'll provide you an outline of coverage for a Plan G from the company that they're proposing. So any legitimate licensed advisor is going to say, oh, you would like a new Plan G? Here is an outline of coverage from Mutual of Omaha, Aetna, United Healthcare, Cigna, any reputable company with the Plan G title and a summary of benefits so you can see that your Plan G is being replaced by a Plan G and you're not being scammed. On the other hand, if someone calls or you call someone and they say, this is a great plan, it's going to cover everything, just give me your information and we'll get you a card. Well, now they're not proving, or they're not establishing the coverage that you'll be receiving, and you'll probably be scammed. So do your homework. Here's the hardest part about Medicare scams, and frankly some of the saddest things. When you work with Medicare recipients, you run into people who've been on a Medicare Supplement or a Medicare Advantage plan for a long time, and there's changes coming to the plans. But because of past scam experiences or fears of being scammed, which are legitimate, they are afraid to talk to anybody. And Medicare Supplements do increase over time, a percentage typically, and those percentages compound. So over like 10 years, you could be way overpaying for that plan G or that plan F or whatever. And so it really does, it is worth it to talk to a licensed advisor and see if you can get on a lower cost, lower premium plan, G or F or whatever you're on now. So you're just going from a G to a G. You're not changing your coverage, but your premium could be cut in half or more. That is worth it for your time. So don't just sit back and overpay on your premium. Go to our website, or if you see an ad, click around the little and make sure that they're licensed. They should provide their producer numbers or their contracts, and you can verify that. We do that. So you've got a number here and a website. Call it, check it out. We are fully licensed advisors, or in the fall, Advantage plans. Man, there are some nightmare Advantage situations where an Advantage plan just drops an entire state. And if you get a letter in the mail that says you're no longer provided this plan, now the ball's been passed to you to find a new plan. And if you're just scared of being scammed and don't get any guidance into a new plan, you may get worse benefits or higher premium for worse benefits, or you may choose a plan that's out of your network. And so it is really important to talk to a licensed advisor like us here, because there are so many options that are hard to navigate, and we like to make Medicare simple. And so I always say, if you call us, I'll promise 2 things. Number 1, it's entirely free. Today I'm going to promise 3 things. Number 1, it's not a scam. Number 2, it's entirely free. And number 3, it'll take less than an hour for us to help you. And so do that. And then once you're working with us, this is another fun thing that happens. People call me and say, is this a scam? And they kind of share fun stories, or we kind of laugh at ridiculous calls or mailers that they get. But that comes with the confidence of working with a licensed advisor like us, where you know that you are on the right plan for you, for your lifestyle, for your budget. We can handle all of that. So thanks for watching. I'm Chris Hansen with I'm Colin Teska with Strive Medicare, making Medicare simple. We'll see you next time.